Namaste. Welcome you all for the yoga session. We will continue with our theme pelvic health. This is the ninth in the series. And find a place near the wall. You have two blankets, one dupatta accessible to you. We will start with the basic stretchings. Lie on your back. Fold both legs. Keep a blanket below the neck. Neck at the center, chin slightly towards the chest. Heels closer to the hips. Foot about 6 inches apart, but parallel. Press the feet. Feel the complete spinal segments, the sacrum, lower back, upper back, cervical. They should all be properly resting. Keep your right palm on the abdomen, left palm on the chest, just to get the feedback from your breathing. Watch your breathing as we inhale the abdominal cavity, that is the lowermost portion, which includes pelvis, then the middle, then the top. They should all expand in that order, all around. And then just relax. Abdominal and pelvis, they contract, and exhalation happens rather effortlessly. Expansion of the pelvis means inside, you should feel. It's a bony structure. So you must imagine, whereas abdominal, there is a clear expansion because of the movement of the abdominal muscles, whereas expansion of the pelvis is more internal. Learn to breathe a little slow. Something like 7 to 8 breaths per minute is good. If you can go a little lower also, it's good. But it should be a very, very soothing, comforting experience. And then watch the transition between inhalation, exhalation, exhalation, inhalation. Chest should remain reasonably stable. Now stretch both hands up. Be with the breathing always. Be watchful. Raise your right leg up. Pull the kneecap, stretch the heel, toes towards the knee. Feel the stretch at the back of the thigh and the calf muscle. And try to flatten the sacrum against the floor. The sacrum, which is the, that flat, triangular, bony surface just below your lower back, that should not take off the floor. Down. Left leg up. Pull the kneecap, stretch the heel. Press the right foot and tighten the back of the right thigh also. Down. One more time, right leg up, pull the kneecap, stretch the heel, feel the region of the hip and the back. Down. Left leg up. Pull the kneecap, stretch the heel. Down. The next movement, right leg up, fold, hold the knee from both hands and pull the knee closer to the trunk. Stretch the toes up, tighten the back of both the thighs and flatten the sacrum towards the floor. Release right leg, chain, left leg up, fold, hold the knee, press the knee closer to the chest, feel your gluteal muscles, back muscles. down. Right leg. Fold, hold the knee. Press the knee closer to the chest. Watch your breathing. Breathe against the pressure of the thigh. It helps to tone the abdominal organs. Down. Chain. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. Release. Left leg. The next one, right leg up. Fold it across Padmasana, taking the heel as close to the root of the left thigh as possible. Stretch the foot up, push the knee back. Tighten the back of both the thighs. Release. Right leg. Chain. Left leg up. Fold it across. Down. One more time, right leg up. Fold Padmasana. Watch your breathing and watch your pelvis in particular. Release right leg. Then chain. Left leg up. Fold it across. Feel the sacrum. Down. The next one, right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee towards the trunk. and then flatten the sacrum towards the floor. Stretch the toes up, tighten the back of both the thighs. Down. Chain, left leg up, hold the ankle joint, pull and press the knee towards the chest. Down. One more time, right leg up, hold the ankle joint, pull and push the knee, flatten the sacrum. Release right leg. Chain. Left leg up. Hold the ankle joint from right hand. Pull it from left hand. Push the knee toward the center of the chest. Down. Now take the dupatta. If you have enough flexibility, you don't need a dupatta, but dupatta will make your practice comfortable. Because in all these moments, it's important to flatten the sacrum towards the floor. So dupatta or belt will be of great help in maintaining postural integrity. Now put the dupatta to the front of the right foot. Hold the dupatta from both hands, stretch the heel, pull the kneecap. Pull the foot down. That will enhance the stretch for your Achilles tendon, through that the calf muscle, and through that the hamstrings, back of the thigh. Press your left foot. Now hold both edges from your right hand, both edges of the dupatta from right hand, left hand on the root of the left thigh. Slowly move the right leg to the right side. Press the right elbow. Stretch the right leg little up. Flatten the sacrum towards the floor. Feel the stretch at the thigh, at the root of the thigh. Feel your pelvis as you inhale and exhale. Now slowly raise your right leg up. Hold dupatta from both hands, release your right leg, then change. Dupatta to the front of the left foot, left leg straight. Pull the kneecap. Hold both ends from left hand. Right hand on the root of the right thigh. Slowly take your left leg to the left side, press the left elbow, straighten the leg completely. Push the sacrum flat against the floor. Use your breathing to feel the boundaries of the pelvis. Slowly bring your left leg up. Hold dupatta from both hands. Release your left leg. Keep the dupatta aside. Slowly get up from the right side. Sit upright. Fold the blanket. Sit on the blanket. Sit upright. Chest and navel up. Do a simple twisting. Left hand on right knee, right hand fingertips on the floor in an exhale turn. Turn the neck also in the direction of the twist. Breathe abdominally. Slowly come up. Chain. Right hand on the left knee, left hand fingertips on the floor in an exhale turn. slowly come to the center. Now take the blanket out. We'll do the following. We are now trying to give a stretch again to the pelvis in the prone position. This is what you do. Align your chest a little away from the wall. How much away depends upon your flexibility of the thigh. Then take your right leg up, right foot against the wall. Comfortably, don't overstretch. If possible, then you can crawl the foot up as you can. Then move closer to the wall so that you can further stretch the leg. Activate your left leg also. You can relax the forehead. Both legs straight. Feel the pelvis. As you breathe in and out. Then slowly get your right leg back. Get up and then change. Line your chest, wall to your left side. The distance you got to adjust. Then take your left leg up, foot against the wall. Take to your comfortable level. And if possible, then you can crawl further up. But you have to go closer to the wall a bit so that you get a good stretch. Again, you can relax your forehead. Keep on activating both the legs. Pull the left kneecap particularly. Now take your left leg back. Press the palm and get up. Now keep a blanket. This is to rest the head. What we are going to do is Upashta Konasana with the help of the wall. You have to go close to the wall like this. Sit close and then turn around, taking the legs up. Keep a blanket below the neck. Legs up the wall, and buttocks should touch the wall. If that is difficult, okay, a little bit away is okay, but better if the buttocks, the thigh and the entire leg are against the wall. Even this so-called Supta Dandasana is very good. It should ensure that you are pressing the sacrum towards the floor. Now from here, slowly take the legs apart as much as possible. Keep the legs straight, apart, pull the kneecaps. You can relax the palms by the side of the trunk. Palms should face upwards, both hands resting at an angle with the trunk. Watch your breathing. You have to slowly inhale. The pelvis and then the abdominal cavity should expand. Then simply relax. Abdomen contracts as you exhale. So in that period, there is no effort involved in exhaling. It's just simply relaxing, exhalation happens. Then towards the end of that phase, you have to contract the abdominal muscles and then the pelvic floor so that exhalation becomes longer and deeper. Contracting the abdominal muscles, you can easily understand. To contract the pelvic floor, you have to actually contract the anal and urinary sphincters, pull them in, then release that grip as you inhale. Ensure that you flatten the sacrum towards the floor. So breathing, slow, deep inhalation. Then exhalation in two phases. First phase, simply relax, let go the air. Toward the end of that phase, contract the abdominal muscles. Then the urinary and anal sphincters, pull them in, and that will activate your perineum and pelvic floor muscles. Contract them deep in. Continue to exhale completely. That is exhalation with effort. So that will help the pelvis a lot. All your important structures will be invigorated. The urogenital organs, prostate glands in men, ovaries, and also as uterus in men. Then also the muscles around the urinary bladder, they also become better. The action of the sphincters will also improve. You must take note of the kind of loading you get with the root of the thigh. Therefore, don't put unnecessary force, or don't ask someone to push the heel down. Don't do such things. Know your limits. Okay, now slowly take the legs up, join the legs, relax for a while. Then fold the leg and slowly slide a bit up. Roll to your right side and get up. Sit upright. Fold the blanket this way. We'll do again Upishta Konasana to the wall, but with a slight backward bend, so that it further helps the pelvis. So here what we do is, you need this height, whether you put 2 blankets or 2 flat pillows or 1 bolster, it should be okay, and about 2 inches gap should be there between the blanket or whatever and the wall. So now this sacrum should rest here, this portion at the lower by that flat bony surface, that sacrum. So that will help to open out the pelvis both longitudinally and laterally. And with the spreading of the legs, that will be further enhanced. This is what we do. Lie on your back, fold the leg, go close to the wall. Once you do this, lift the hips up, slightly crawl forward, rest the sacrum, on the support. Stretch both legs up. Legs straight. Ensure that the sacrum is properly rested and you lift the chest up. Chin towards the chest. You can relax the arms by the sides of the trunk. Then slowly spread both legs as apart as possible. No need to overstretch. Legs straight. What is more important is a good breathing. Now you have a good access for your pelvis. You have to use your breathing intelligently, sharply to irrigate the region of the pelvis. You have to slowly inhale, allow the pelvis and abdomen to expand. Then simply relax, let go the air. Toward the end of that phase, engage the abdominal muscles and the urinary and anal sphincters to contract further, to extend the exhalation. Then release them as we inhale. Any discomfort at the root of the thigh? Bring the legs up, relax for a while and then repeat. So feel the pelvis completely, the sacrum at the back, hip bones at the sides, the perineum and the floor of the pelvis at the bottom, the pubis, pubic bone at the top. Now slowly bring both legs up, fold, Gently slide down, rest the back. Get up from the right side. Now we will do a simple forward bend. Upavishta Konasana. Now keep the blanket little away from the wall. How much away? You will find out yourself. You have to sit upright, close to the wall, and then spread both legs apart. You should be able to do it comfortably. So if you keep it too close, you will not be able to do that. Sit upright, pull the kneecap, then gently lean forward, rest the forehead. You can keep a towel or some soft thing, if you wish, between the forehead and the wall. Close your eyes, don't allow the trunk to shrink. Watch your breathing, especially watch your pelvis. Here you do only slow inhalation, slow exhalation, that is effortless exhalation. Because it's a very relaxing posture. Slowly come up, join the legs, sit upright on the blanket, chest and navel up, palms should face upwards. Sit in Swastikasana itself. Especially these Upavishta Konasana variations, take good care to ensure that you don't create unnecessary tension at the root of the thigh. Right, palms should face upwards, tip of the thumb and index finger in contact. Close your eyes. Now there are two lower chakras. The Mooladhara chakra and the Swadhisthana chakra, also referred to as the root chakra and the sacral chakra, which have profound influence on the health of the pelvis. So now watch the root of the spine. How do you locate? The region between the two excretory organs is perineum. Just locate the center of that and slightly above that. That is the region where the root of the spine, the tailbone ends, and that is also the location of the root chakra, the Mooladhara chakra. Watch that region. Slowly inhale. Allow the pelvis and abdomen to expand. Slowly exhale. Abdomen contracts. Imagine as if you are inhaling into Mooladhara and exhaling from there. Develop that feel to sensitize that region. This root chakra or Mooladhara chakra has the Bijakshara as Lam. So pronouncing that Lam and feeling the vibrations in the region of the Mooladhara chakra helps to balance the chakra, which promotes the health of the pelvis in particular and the complete system in general. So we shall pronounce the Bijakshara Lam and watch the vibrations, especially in the region of the Mooladhara chakra. You have to slowly inhale. As we exhale, pronounce Lam and feel the vibrations at the base of the spine. Join with me. Slowly inhale. Be relaxed. Continue to feel that region. Now feel the sacral chakra. Feel your sacrum. That is behind the genital region. That flat bony segment below the lower back. That is the region where you have to feel. That is the Swadhisthana chakra. Make that as your breathing center now. As you inhale the breath, imagine as if it is reaching Swadhisthana chakra, and from there it is going out. The Bijakshara associated with Swadhisthana is Vam. Vam. Procedure, you have to slowly inhale, and as you exhale, pronounce the word Vam and feel the vibrations in the region of the sacrum. So to slowly inhale, with exhalation pronounce the word Vam, feel the vibrations in the region of the sacrum. Join with me, slowly inhale. Vam. Om. Be relaxed. Salutation to Sage Patanjali. Take a deep breath. Yogena jittasya padena vajam bhalam sharirasya cha vaidyakena yopakarottam pravaram muninam patanjalim pranjaliranadosmi ಹರಿ ಓಂ. ಶ್ರೀಕೃಷ್ಣಾರ್ಪಣಮಸ್ತು. ಶ್ರೀ ಗುರುಭ್ಯೋ ನಮಃ. ಶುಭಮಸ್ತು.